All right. Hello, everyone. Can everybody hear me? Great. I'm Dr. Alissa Zingman. I'm a board-certified physician in preventive medicine, occupational medicine, and environmental medicine, founder of Prism Spine and Joint in Silver Spring, Maryland. Oh, that is my husband, who definitely deserves a lot of credit for everything, including letting me know I can look down here instead of over there. Thank you. All right. We do integrative medicine, also Physioline, which is our program, and Ehlers-Danlos Syndrome Research Foundation, which is very, very teeny. And we do not do something like this amazing conference, which I am very, very grateful to be part of. We're going to talk about hypermobility, Ehlers-Danlos syndrome, injury prevention. I have a background in orthopedics and did the majority of an orthopedic surgery residency before my health declined, which we later found out was due to the triad, pentad, septad, what have you. I would guess that people in the room who have this diagnosis could empathize with this. I knew exactly what to do, but in a much more real sense, I had absolutely no idea what to do, right? So I think we've all been there as patients. And I actually probably think that most of us who take care of EDS patients as healthcare professionals have been there as well with our EDS patients at one time or another. And I have included a little bio sketch, but in the interest of time, I'm skipping it, but it's there for you for later. And this kind of explains why I'm so passionate about prevention, occupational medicine, injury prevention, a little Claire Francomano being my fairy godmother moment, and all the rest. Here's my job for the next 20, now 19 minutes. I'm really hoping that I'll be able to give a perspective on how things tie together and how if we want to heal musculoskeletal tissues, joints, spine, ligaments, tendons, discs, all of it, we have to look at the whole person. We have to look at all the organ systems. And EDS patients require an approach that is much more sophisticated, holistic, and involved. We can't treat shoulder instability as something that is only going on between here and here. We can't treat craniocervical instability as something that is only going on between here and here in this patient population. So I really hope that I can give everybody a little bit of a perspective into that, and then I'm going to give you my injury prevention top 5, which is challenging because I could probably stand up here without any preparation and talk about this for 20 hours instead of 20 minutes, but I'm going to do my best. I'm going to try to apply public health principles and examples. That bio sketch we didn't talk about. I do have a master's degree in public health from Johns Hopkins focusing on injury prevention, which was a wonderful experience, particularly since I got to do it during the time period right after I left orthopedic surgery, right before I got the diagnosis, which I got in 2017. And I shared with Dr. Francomano last night that when she started talking to me about mast cell activation syndrome, which I never heard of before, and POTS, which I thought maybe I had heard of before, and a port, which I had one for 2 years and I'm getting my next one next week, I was like, this woman is she's really dramatic, you know? When, of course, we don't know what we don't know, right? And so putting in some ideas for self-assessment, context, knowledge, and of course, all in the interest of empowerment, right? Here we go, we're off, all right. Rule number 1, early and often. 2, it's all connected, this canary in the coal mine idea, which I'm gonna get into all these. Rule of 3s we're gonna get into. Anyone who has spent more than 10 minutes in my office has probably heard me say, relax, but don't collapse. I called this 5th one Simmer Down, but I think I've renamed it about 27 times just in the past week alone. So here we go. Early and often, don't wait, all right, don't wait. Don't be like this before you ask for help, all right? Anyone who, like me, was born before GPS has been in a car begging someone else to ask for directions, all right? Just ask for directions, okay? All right, the pressure, okay. So I love Vince Lombardi quotes and Winston Churchill quotes, and I actually love this quote. However, it doesn't mean you can't start just because you don't know how to do it perfectly, all right? We're all guilty sometimes of analysis paralysis, but a good plan today is better than a perfect plan tomorrow. So just get started. Start small, avoid blame. I cannot tell you how many times, I mean, it's multiple times a day, people come into our office with their head hung. I did something really stupid, and I need you to fix my neck, my hip, my this, that. They almost never did anything stupid. It's just like a judgment that they don't need to be applying to themselves. They took out the trash or something. I mean, were they supposed to leave the stinky salmon skin sitting in the kitchen smelling up the whole place for a week? It's okay, And so, and the speaker just before me, I think, touched on this very beautifully, as have other people. I think whatever emotion you have, it's not wrong, but it's the emotion about the emotion that can get us in trouble. So you threw your back out, reaching down to do whatever you reach down to do, okay? That made you feel whatever, sad, angry, whatever it was, right? But then you felt guilty about it, right? The sadness, the anger, it's there. It's normal. It's part of the human experience, right? But it's the blame and the anger about the sadness, right? That's where we're sort of just torturing ourselves, right? Because we didn't ask to not be able to pick something up off the ground, right? And there's nothing inherently negligent about the fact that we picked something up off the ground, right? And so it's having a little grace for ourselves, I think, and it's very difficult to do that when we feel like, I should have known better than to do that, right? And so I think using the past only to learn from, but not to judge, and looking forward. And then also, when you realize you were judging yourself from the past, forgive yourself for that too, and get just back into the future mode. Adjusting expectations, this takes time and practice. It's hard. It's a constant, ongoing effort. I think I'm doing something like 10 hours of things here in the next, in a 72-hour period. Fantastic evidence that I am still working on reasonable expectations of myself. But, so I don't want everyone to feel like I'm putting myself up as the poster child of someone who's being perfect at these things. And, you take big swings, and sometimes you hit, and sometimes you miss, and that's okay, right? But I think, try to plan ahead, right? Try to communicate in a way that's strategically, so you're not only setting your own expectations, you're setting expectations of others. And hopefully this will give you some good tips. I gotta tell someone, this still says I have 20 minutes left today.
I got you.
but I don't know. What? Oh my God, okay. And then consider what you do and do not owe others. And the example I always like to use for this, and if anybody here works for TSA, shh, okay, is that my patients are so worried going to the airport. And I'm saying my patients, and I'm not saying me. And I just want to be really clear about that in case any of you work for the TSA. But they're always worried about going to the airport because you got to pick up your bag and put it on the conveyor belt, and explaining to the TSA agent that you have EDS, right? You don't owe them an explanation about heritable connective tissue disorders in the security line at TSA, okay? Thank you. That's nice, thanks guys. Okay, so I had neck surgery. I'm not allowed to lift more than 3 pounds. Is there somebody who can help me with this? That's it, simple, easy, get through the line, get where you're going, goal-oriented, the end, right? Now, lying about that to your spouse, friend, coworker, boss, no good, all right? TSA agent, who cares? Get where you're going. Okay. Number 2, it's all connected. Okay. Oh boy, there are 8 minutes left. That's okay, all right. Inflammation, public enemy number 1, okay? All inflammation is systemic inflammation. Orthopedic surgery, broken wrist, do a surgery, plate and screws, measure, systemic, blood, take it from anywhere in the body, blood circulates. What do we see? Inflammatory markers up, okay? Lots of studies on this. Example, rotator cuff, all right? This is my study from when I was in orthopedics. All right, so here is a very unfortunate mouse that some really mean orthopedic surgery resident was forced to operate on and tear its rotator cuff. That was me. Okay, so the rotator cuff, is there a pointer in here on this thing? Yes. Is it this one? At the bottom, is it that? Oh, okay, there we go. All right, that's the rotator cuff. Here it is, okay? That's, I wanna say 13 weeks later, okay? See how it's not as robust? All right, so it was cut, but we didn't like remove the blood supply, right? But look how it's getting kind of wispy, okay? Not only that, check out the bone. Here's the nice bone marrow. Uh-oh, this red part, okay, purple bone marrow. This red part is the trabecular bone, which is what gives the bone structural integrity. Uh-oh, look at that, hardly any. 27 weeks, I wanna say, or 32 weeks, I forget. Bone marrow now taking over almost all of this space here, okay? Trabecular bone, ew. Actual rotator cuff muscle, that's one of the 4, supraspinatus right there, totally wispy, okay? And even more pronounced, this was a nice round, beautiful humeral head ball of the ball and socket, and this was a beautiful socket that was nice and smooth. Ain't nothing smooth in this joint, right? Okay, 40 whatever weeks later, totally lumpy bumpy, can't even find the socket. This pink stuff here, that's not even bone. That's just scar tissue, okay? So structural problem having biological consequences, and the biological consequences causing an even bigger structural problem, okay? So we have to address all the things. All right, rule 3, 3 planes of motion. Okay? Jungle cat. Move like a jungle cat. I always say this. When you watch a puma, a lion, a tiger, whatever, or just a house cat, honestly, move, they are not moving one part of their body without the support and involvement of their whole body, all right? In Physioline, we call this pure planes. So we basically want to see where our imbalances are, and an easy way to figure that out, and this also is an easy way to identify subluxations if you don't have that osteopath or PT who can run their finger along everything and say, ooh, this is 15 degrees this way, and da-da-da-da-da-da, which is one of my hobbies, but not everybody has somebody to sit for 5 hours and figure out every bone in their body every day, right? And in fact, nobody has me to do that for them for 5 hours a day either, including me. So one of the easy ways is isolate out the 3 planes, don't force your range of motion, okay? And see where the asymmetries are, and now you kind of know where you're targeting, right? And then the symmetries are not just range of motion, which again, using your full range of motion for every plane in every joint may not be a good idea depending on what you have going on, or it might be, and that's where you need some supervision and some advice from whoever you're working with, right? Okay. But that's where you can start to find imbalances, but it's not just range of motion. It's also about strength and endurance in all those ranges, in all those planes, okay? The neck is the most complicated in how you move your head, even though it's the one I put up. That is, I am not suggesting that anybody either right now or ever go home and start moving their head all around like an owl, okay? Please don't do that. Thank you. You can start with something like maybe, your hip while you're lying down and not bearing weight through it, and just see. And then if it hurts, just stop. Okay. But yes, we want to, be doing corrective, just as previous speakers have said today, yesterday, right? Working on that. Okay. Hierarchy of controls, I will skip for the sake of time. I have no idea if you will have access to these later. You will have access to these later. Okay. I think I mentioned earlier, this is one of my favorite things. I'm gonna make it, girl. It's the last two are the shortest. Okay. Relax, don't collapse. Okay. How many people in this room have been told in PT at some point or another, don't do your max effort, just do a little bit? Raise your hand. Great, okay, good. So raise your hand if you feel like you really understand why you were told that. Oh boy, okay. So if you're watching a recording of this, almost everybody has been told that. I think one person understood why. Okay, so here's what, hey, how do I go back? Okay, so here, we're gonna do this quick, okay? So, right now, don't change anything, close your eyes. If your back is leaning in to the back of your chair and you don't feel weight pushing through your feet at all, and your feet are kind of tucked back under your chair, you're at least a little bit collapsed, okay? So, we're gonna go, please don't do max effort, but we're just gonna go for like a slightly robust effort. I see you. Okay, we're gonna go, sorry, we're old pals. Okay, so we're gonna go for feet flat on the ground now, and we're gonna scoot your tushy a little bit forward so that we're not resting our back into the back of the chair, okay? All right. You're probably now a little more engaged, but now I want you to actually feel the spot on the top of your head that would be like the soft spot on a baby's head, kind of right in the middle there. And I want that to be pointed directly to the ceiling, okay? We all got told, I don't know if the younger millennials or Gen X were told this, but the older millennials and the Gen Zs and the boomers, we were all told to sit up straight. And that meant to stick your chest out and squeeze your shoulder blades. Right, okay, we're not doing any of that, right? All we're gonna do is just push through our feet and let this soft spot go up towards the ceiling just a little bit, okay? It shouldn't tip the chin up. That's what I'm trying to tell you. Just the soft spot goes up, okay? And you're pushing through the floor. And give it like a good push, okay? Now you're doing nice, active sitting. Okay, I'm stopping in 1 second, okay. Okay, now, just do half of what you're doing and you're relaxed, not collapsed, okay? Do half of that. You're still relaxed, not collapsed, okay? So you just work down from there, but don't go all the way back into the collapsed. Last slide, don't forget to sleep. Lay down. If you hold a water bottle out like this all day long, it gets awfully heavy, okay? But if you put it down, take a little break, you can pick it back up again. It feels light again. That's why you need to lie down and take a gravity break. Okay? I have a little thing of how you can figure out what you need, when you need to brace, when you need to lie down, and thank you. And I'm done. Woo! Thank you very much.